When it comes to cancer risk, is obesity the new smoking? My name is Dr. Lindsay Ogle, and I'm a board certified family medicine and obesity medicine physician. And as a physician who was trained in primary care, preventative health screenings, including cancer screenings, are a very important part of my practice and something that I'm very passionate about. And also modifying risk factors for cancers and chronic conditions that can shorten or negatively impact somebody's life. And cancer and obesity are two of those risk factors that are extremely prevalent in our population. And we all know by now that smoking negatively impacts our health. It increases our risk for many types of cancers, and most notably lung cancer, but also esophageal cancer, mouth and neck cancers, kidney cancers, and many other cancers, bladder cancer. And it also increases our risk of cardiovascular disease, stroke, and many other health conditions. Obesity actually does the same thing. Many people are aware of the metabolic impacts of obesity and its association with chronic conditions like type 2 diabetes and polycystic ovarian syndrome, but it's less commonly known that obesity increases risk of cancer. And there are at least 13 well-documented unique cancers that obesity increases somebody's risk for. So by decreasing or stopping smoking and achieving and maintaining a healthy weight, decreasing your risk of many different types of cancers, decreasing your heart disease and stroke risk, as well as diabetes and other chronic conditions. So in my humble opinion, as a family medicine and obesity medicine physician, two of the best things that you can do for your health are to never smoke or stop or reduce your smoking now and achieve and maintain a healthy weight. And this is something that your primary care doctor and or an obesity medicine doctor can help you achieve. There is a lot of hope and treatment available for both of these things. So do not be afraid to ask for help. I'm going to include some links below to get assistance with smoking cessation as well as obesity care. But today, in this talk, we're going to explore that association between obesity and cancer risk. But to answer the initial question, is obesity the new smoking when it comes to cancer risk? No, it's not. Smoking is still the most significant modifiable risk factor when it comes to cancer. Smoking is responsible for approximately 19% of cancers in the United States, and it's responsible for 28% of cancer-related deaths in the United States. Compare that to obesity, which accounts for approximately 7 to 8% of both cancers and cancer-related deaths in the United States. We're going to go over what those 13 cancers are and why there is an association and some things that you can do to screen for those cancers or watch out for any signs or symptoms. But before we get there, I also want to highlight some compounding risk factors to be aware of. So that association with obesity and cancer is disproportionate for a couple of different populations. And the first one I want to address is for females. The association between cancer and obesity is stronger in women, and this is thought to be hormonally related because many of the cancers that are more common in women can be triggered by estrogen and hormone levels. So about 5% of cancers in men are related to obesity, compared to 11% of cancers in women are related to obesity. So that's a pretty big difference between the two genders. The association between obesity and cancer is also exaggerated and compounded the earlier somebody starts to struggle with the disease of obesity. So if you have struggled with weight as a young kid or young adult, and you've been dealing with this for decades now, that is going to, over time, have increased your risk for many of these cancers. So that's something that's important to be aware of, compared to someone who later in their life started to struggle with weight. As with many chronic conditions and medical concerns, race unfortunately plays a factor, both from a genetic standpoint as well as structural systems that we live in. And so non-white populations are at a higher risk for obesity-related cancers. And then anybody who has both obesity and a metabolic condition is at higher risk of developing obesity-related cancers. Another thing I would like to highlight is that despite what the underlying cause of a malignancy or a cancer is, somebody that is living with obesity is going to have disproportionate outcomes compared to somebody who has a quote unquote normal BMI. Individuals with cancer who have a BMI of 40 or greater have a higher chance of mortality compared to somebody with a similar condition who has a BMI of 25 or less. The relative percentages for that are men with a BMI of 40 or greater have about a 50% increased mortality than somebody with a BMI of 25 or less. And for women with a BMI of 40 or greater have a 60% increased mortality compared to their counterparts with a BMI of 25 or less. So now let's talk about what those 13 types of cancers are. I'm going to start with the one with the strongest association with obesity, and that is endometrial or uterine cancer. And women who have a BMI of 40 or greater are at 7 times the risk of endometrial cancer compared to women with a BMI of 25 or less. 7 times the increased risk. So there's a very strong association, and this is because of the increased estrogen that obesity lends itself to. And with increased estrogen levels, the endometrial lining is triggered to grow and proliferate, and that can go unchecked and can lead to cancers. And the major symptom that someone's going to have if they have endometrial cancer is abnormal uterine bleeding, or abnormal, spotting in between periods, or all of a sudden having heavier cycles, or any bleeding after menopause. All of those symptoms should be evaluated by a primary care doctor or a OBGYN immediately, especially if somebody has obesity, because we need to rule out endometrial cancer. And that can be done with an ultrasound and a biopsy. Sometimes we start with one, sometimes we do both, but we need to rule out endometrial cancer in those cases. So that is something to absolutely be aware of, and do not ignore abnormal bleeding, especially if you are living with obesity. The next strongest association is esophageal cancer. So this is the tube down the throat and the chest that food goes down. And the association is about 4 to 5 times. So somebody who is living with obesity has a 4 to 5 times higher chance of having esophageal cancer compared to someone without obesity. Symptoms of this would be difficulty swallowing, and this can start with difficulty swallowing large food items, or difficult to swallow food items like steak or sandwiches or bread. And it can progress to difficulty swallowing even things like yogurt or applesauce or fluids. If you are experiencing that, absolutely tell your doctor right away, and you need to have an EGD, which is where they take a camera and they go into your mouth and take a look in your esophagus and see if there's any abnormalities. It's also important to note that GERD or chronic acid reflux can also increase somebody's risk of esophageal cancer. And many people who live with obesity also have GERD and acid reflux. So if you've been struggling with acid reflux and it's not been managed well, talk to your doctor. It's important to have that under control because the prolonged reflux that's occurring, that acid and getting from the stomach into the esophagus will irritate the esophagus and can increase your risk for cancer down the line. And there's lots of ways that we can manage that. So definitely communicate if you're having acid reflux to your doctor. Next is liver cancer. And individuals who are living with obesity are 2 times as likely to have liver cancer as other individuals. This is something that we do not have screening guidelines as of now for people who are living with obesity. But if somebody has MASLD, metabolic dysfunction associated steatotic liver disease, also commonly known as fatty liver disease, or a history of hepatitis C or hepatitis B, they should be getting periodic liver ultrasounds, which would be a way of screening for liver cancer. All individuals, regardless of your infection risk, should be screened at least once for hepatitis B and hepatitis C. The next cancer associated with obesity is postmenopausal breast cancer. All women, regardless of risk, should start getting breast cancer screening around age 40, and most people should repeat this annually. There are some variations in different societal guidelines about when to start and how frequent and what modality to use based on certain risk factors or results on the initial mammogram. So talk to your primary care, OBGYN, or breast radiologist about what is recommended for your case. But at age 40, you should start getting the screening done, and it's important to continue until about age 74. Again, that can look different from person to person. But if you are at increased risk because of family history, then you may start screening earlier. And if you are extremely healthy, you may continue to screen later than 74. Colorectal cancer is also associated with obesity. Colorectal cancer is one of the most common cancers in adults. It is one that we start screening for the average risk person at age 45. And there are several different ways that we can screen for colon cancer with colonoscopy or Cologuard or FIT testing with just stool testing, so you don't have to go through a procedure. Talk to your doctor about what is a best fit for you. But it is very important that everybody start screening for colon cancer at age 45. But especially if you live with obesity, you need to start screening because you are at higher risk for colorectal cancer. And again, if you have a strong family history of colon cancer or cancers in general, talk to your doctor because you may need to start screening earlier. And also, if you have Crohn's disease or ulcerative colitis, then you also should start screening earlier. Pancreatic cancer is associated with obesity. This cancer is really difficult to diagnose at early stages because it typically doesn't have that many symptoms. Something that people typically present for is that they feel full on less food. And that's also the case for individuals on a GLP-1 medication. So this can be tricky to differentiate. If you have any abdominal pain, if you're losing weight very quickly, if you are very full, when you're eating meals, even if you're on a GLP-1 medication, talk to your doctor because you may need to be screen for this. This pancreatic cancer is not something that we routinely screen for in everybody at this time, but if you're having certain symptoms, then it may be worth getting some imaging of your abdomen to rule this out. The remaining cancers are other cancers that we do not have guidelines recommending routine screening and have extremely variable presentations. That includes kidney cancer, gastric or stomach cancer, gallbladder cancer, thyroid cancer, meningioma, which is a brain cancer, and multiple myeloma, which is a blood cancer. So all of those cancers are also associated with obesity and have various diagnostic criteria and workup. So why does this association exist between obesity and cancers? And this is related to the adipose cells, the fat cells. As I've mentioned before, fat cells are not just there. They are not inert. They release hormones and inflammatory markers and signals throughout the body. And it is those signals and those hormones that can trigger and encourage cancer cells to grow. And that happens from the hormonal level, like I mentioned. So that is often related to increased insulin levels, increased leptin, decreased adiponectin. Those can be growth signaling on those changes, and that can encourage cancer to continue to grow. Estrogen, as I mentioned earlier, is released by adipose tissue. And so for estrogen-related cancers, this is a major factor in the development of those cancers. Adipose cells also release inflammatory markers, and that chronic inflammation can be a trigger for cancer growth. So I don't want this to scare, alarm anybody, but I just want to be honest about what the true risk factors are for having excess adiposity. It is not about how somebody looks. I definitely don't care about that. I care about my patients' long-term health and well-being. And once you learn these associations and see how clear that is, it is hard to unsee it. And it is hard to know that there is this risk factor that can cause so many different types of diseases that can lead to a shorter lifespan and definitely a shorter health span. It can cause illness throughout somebody's life. If there are a few underlying factors like smoking and obesity, why not focus on those underlying factors, especially in a time when we have such effective treatment? And that is why I went into obesity medicine, because my initial goal and my current goal has always been to help my patients achieve and maintain their health and well-being so they can live better and healthier and longer lives. And so by helping patients quit smoking or reduce the amount that they're smoking and help patients achieve and maintain a healthy weight for them, that is achieving those goals. And so that is what I want for you. Please check out all the links below so you can get the resources to support you on your health and wellness journey. If you have any questions, please let me know. I would love to hear your ideas on future topics, and I hope you have a wonderful week.